The Delta variant continues to wreak havoc in South Africa's battle with Covid-19, with a death toll that shows no signs of slowing down. In the 2 weeks since the country moved to lockdown level 3, a total of 4,848 people have succumbed to Covid-19 related complications. More than 12,000 cases have come back positive in the last 24 hours, with 271 more deaths reported. The Western Cape has taken over from Gauteng as the epicenter of our outbreak. Meanwhile, the World Health Organization has announced that over 4 million deaths have been recorded around the world since the pandemic started. Over 8 million South Africans have so far been vaccinated. Let's talk more then about South Africa's Covid-19 battle. Bring in Dr. Ridhwaan Suliman, Senior Researcher at the Council for Scientific and Industrial Research, the CSIR. Doctor, always good to have you on Newsfeed PM. Great to see you. What, if any, were the main observations for you this past 7 days?
Good afternoon, Tembekile. So I think if we look nationally, we are still seeing a promising decline across all indicators. However, what is of concern and what we need to look at it with a bit of caution, because certainly the inland provinces are on a separate trajectory compared to the coastal provinces, which are still very much on the rise. So nationally, we're seeing that the rate of decline has slowed due to a lesser contribution from the inland provinces, which are declining, but a greater contribution from the coastal provinces, which are still on the rise.
And on coastal provinces, the Western Cape currently is South Africa's epicenter, having surpassed Gauteng in the last 3 to 4 weeks. What is the picture there? Because authorities believe that they may have seen the worst of the third wave.
Yeah, so Western Cape is the epicenter of the third wave of COVID-19 in South Africa, with the province reporting an average of over 3,100 new cases per day over the past week. So in absolute numbers, the highest number of reported cases compared to any other region. And if we scale that by the population size, that's 45 new cases per 100,000 people in that province, which is high and at a similar level seen at the peak of its second wave. I think, as you mentioned, that some hopeful signs is that the rate of increase of infections has slowed, just 5% up compared to a week ago. But I think it's a bit too soon to say if it's a peak. We do need to wait a few more days. Hopefully we'll start to see a decline in that infection rate over the coming week. Unfortunately though, hospitalizations do continue to increase in that province. Last week saw a 9% increase in new hospital admissions compared to the previous week. And sadly, as we know, deaths do lag, and the number of reported deaths in the Western Cape is also still on the rise.
And nationally, the deaths have been going through in the last week a bit of a seesaw, haven't they? On some days, we're seeing just above 200 deaths recorded a day. And then while you're looking at that, the graph begins to surge and we record over 400 new COVID-related fatalities.
Yeah, so the number of reported deaths do remain high. I think if we look at the 7-day average of reported deaths, it gives a better indication of the trend. And currently it is high, sort of plateaued at that figure of just under 400 new deaths per day, up 3% week on week. So while the number of deaths isn't as high as what we saw at the peak of the second wave, I think what's more important is that we're seeing a high number of deaths reported over a sustained or longer period of time, and unfortunately this will continue. So as we're still seeing a rise in the number of infections reported in the coastal provinces, and as well the number of hospital admissions in these coastal provinces as well, we will unfortunately continue to see the number of reported deaths still remain high.
And Doctor, we've seen Gauteng go through its third wave at the beginning of winter, then came the Western Cape. From the available data, is there any assessment, any measuring or predicting where else we're likely to see an epicenter?
I think the province probably of most concern right now is KwaZulu-Natal. Even though Western Cape is the epicenter, there's signs that it may be slowing down in terms of the infection rate. But in KwaZulu-Natal at the moment, there's still no sign or no indication that the infection rate is slowing down, and unfortunately still picking up. It's reported an average of over 2,100 new cases per day over the past week, and that figure has increased by almost 30% week on week. Unfortunately, we also seeing a higher number of deaths being reported in the KwaZulu-Natal as well, following this rise in infections.
It's a long weekend, and sadly, we do tend to throw caution to the wind when we go out and meet with friends and family, precisely because many of us hadn't seen them during level 4, for example, of the lockdown. When are we likely to see the impact of the holiday on COVID-19 and our trajectory?
Generally, we have to wait for about 2 weeks before we see any effect of current events on the epidemiological numbers. So this weekend's current behavior and possible infections may only be seen in 2 weeks' time. I think that's why it's important to remain vigilant, and it's particularly in these coastal provinces, Western Cape, KwaZulu-Natal, Eastern Cape, and Northern Cape, which are still on the rise and where hospitals are being stretched. We do need to remain vigilant and not let our guard down, because hospitals are stretched and we need to try and ease the burden on the healthcare facilities. So I think we do just need to try and avoid gatherings as much as possible to limit the spread and the rate of transmission.
Dr. Ridhwaan Suliman, always so great to speak to you. And by the way, if you're watching us for the first time here on Newsfeed PM, we speak to Dr. Suliman every weekend on a Sunday at this time to get a broader picture of what the week has looked like in South Africa, tracking the coronavirus pandemic. Day 500, can you believe it, of South Africa's national lockdown. It was in March last year that we began this journey, and many of us had perhaps naively thought it would all be over by now, but here we are, still fighting this virus.